Okay. Well, thank you so much for inviting me to present what is early morning here in Seattle, Washington. I'm Jonathan Bricker. I'm at the Fred Hutch Cancer Center in the University of Washington. I'm going to talk about the QuitBot, uh, conversational chatbot for quitting smoking. I'm going to talk about the user-centered design process, mainly focusing on how we developed the generative AI aspect of it. And then I'm going to talk about the randomized control trial that we're conducting now. Um, so this is our wonderful team at the Cancer Center. And I also want to acknowledge Microsoft, who is lent to us their several engineers to assist us in this process as a donated philanthropic effort. These are my funding sources. And I want to just say that in general, the Habit Lab that I direct has three core missions: to design, to test, and to disseminate our interventions. We give away our interventions for free. And our ultimate goal is population level impact. And this is what we've been doing for the last 17 years. So I just want to focus in on the development process. There's a paper you can look at that goes into this in depth. I'm going to focus on some key points that are relevant to today's seminar, but you can find the paper citation listed at the bottom. There's an 11-step process that we went through, starting with a conceptual model and then developing content, conducting needs assessments with adults who want to quit smoking. We developed a persona that was essentially modeled after a professionally trained coach for quitting smoking. So we interviewed a range of coaches whose job is to provide smoking cessation intervention. So that's the persona we modeled it after, and that level of professionalism that they would provide. We conducted prototype testing, we developed the functionality, we programmed it, we conducted a diary study, and we did do a pilot trial. I'm going to highlight the results of the QuitBots efficacy in our pilot. And then I'm going to focus a lot on step 11, which is how you develop those free-form abilities for someone to ask any question they want. Rule-based chatbots is one type of chatbot. The generative AI chatbot is another type. We did a hybrid, much like Felix is doing now. So this is the conceptual model that we are working from, and it essentially looks at how the intervention impacts the core therapeutic alliance factors of creating a bond, a sense of shared goals, and a sense of shared tasks and perceived understanding about where the treatment is going. This is important in any good therapeutic alliance, and we think that would impact engagement, in turn impact cessation. We think there are things that can moderate the impact of an intervention of a chatbot, which is used to be known as a conversational agent, but now they're called chatbots. Uh, Trust, your level of social support, sex, age, race, and education, we think are important moderators. The clinical content is listed here as a fully structured program, just like you would have in a standard quit smoking program. So there's 14 days of conversation. They last about 2 or 3 minutes of back and forth chatting through text that go over any standard clinical intervention you'd want to have according to clinical practice guidelines, like your motivations, setting a quit date, reviewing FDA-approved medications and seeing if they're a good fit for you, and so forth. There's then content focused on the pre-quit, quit day, and then there's 28 days of post-quit content focusing on withdrawal slips, managing your mood, managing cravings, and progress tracking. And then there's another set of content for people who aren't quite ready to quit or who change their quit date and they want to get some more support. So that focuses on motivations and progress tracking. And then there's the anytime help features, where someone could say that they want to deal with urges or mood that's getting in the way of quitting and slips. So it's a full program, standalone program for quitting smoking, following U.S. clinical practice guidelines. Now, I'm going to highlight just the from the pilot that we conducted in the QuitBot arm, our early pilot, and you could find this in the paper I cited earlier. This is the 3-month post-randomization quit date in the QuitBot arm, and we see the 7-day point prevalence is 48%, 30-day point prevalence 31%, and then among people who completed the arm, who completed the whole treatment, you'll see the quit rates are much higher, 81% and 63% respectively. So now what I really want to focus on, which I think puts this in context of today's seminar, is the large language models. We started this process of working with large language models in 2020, before ChatGPT was released and before there was the ability to just go in and start to modify your content based on instructions that you give it. There's still an important part of that which is true today. We were having to create this ourselves, where we would have to generate, well, what are types of questions people could ask? So we generated about 8,000 question and answer pairs based on transcripts from the National Cancer Institute's call center. There are 800 Quit Now call center. For 804 Cancer call center, they have an online system through their website where they shared with us the transcripts that we were able to mine and look at what are the types of questions that people generally ask about quitting smoking. So from that, we developed the questions, and then with a panel, developed what is appropriate answers to those questions. And so we needed to develop a model that could be able to be trained to provide appropriate answers and detect the type of question that the person was providing. To do that, we had to compare different types of large language models. So when we're first doing this, so year two, this is 2021, there was the main chatbots available to programmers were Dialog GPT and Parl AI. And so we needed to compare them on their ability to provide good answers. So that meant that our own team was reviewing and coding the quality of those answers. That was an iterative process that then led us to improve the types of questions that we were asking, and we needed to see brighter ways in which lay people would ask questions. So we went into Prolific, and we had people ask their own questions about quitting smoking, and we needed to be able to integrate the ways they asked those questions and the ambiguity in which people naturally ask questions when they're writing text, and the model's ability to be able to parse those and understand what was the user's intent. To do that, we were working with ChatGPT 3, which at that point was what was available, and then compared it with Dialog GPT. And then there are fine-tuned versions of that. So all GPTs that you see right now, there's always variations of that have different levels of training on them. And I recommend, if you are developing your own chatbot, that you do that. You compare the variations even within a certain enterprise, in this case, the GPT, to look at their performance. And so we compared what they call the Da Vinci and the Curie models to see which was performing better. And once we developed a working prototype of this ability to ask questions of your own, we conducted a 14-day diary study with users. There were 10 users in the study, and we looked at usability and the appropriateness of the answers. And that was really helpful because it allowed us to find out, well, what was performing best and what types of changes are we going to make. And we found out at that point the GPT-3 Curie model was the best performing model at that time. It was very helpful, but we realized that we still need to continue developing more questions. And so we generated another 3,600 questions and to see other new ways people could ask questions. So as you're seeing here, as the story is evolving in this process over time, it's a process of you develop a set of questions, you start to test it with a large language model, you look at the performance, and then you go back and you start to expand the library of questions, and then you test that with that model and compare it with other models. And we found that framework was very helpful to us in being able to get to a point where the bot could answer a wide range of questions about quitting smoking. Um, uh, we later, as OpenAI would develop and release new large language models, 3.5 came out. So we were able to look at how it performed, and we found that that was actually performing the best. So at that point, we settled on that being the model that we would be using and testing in the trial that I'm going to tell you about. This is so it is a curated model, and there are many features to it. One of the most important ones we found was key was to filter out hate speech. The model is also able to detect any kind of emergencies like suicidal or homicidal type messaging that would then alert our clinical team, so we would need to intervene. Luckily, we've never had to do that, but it has that ability. The value we learned from this process was you need to take your time to iterate. And we were doing it during a transformative period within large language models. That is still true today. What is the state of the art today is going to become antiquated pretty quickly in the next year, and the same is true the next year. So you have to be flexible and nimble and be willing to continue evolving your models as you stop, you test them, but then you also need to recognize that these are going to continue to improve. And there's an enormous amount of training that is needed in order to make these models perform well. I'm going to skip the overview of the bot just for time. You can download it for free. You just go to the Google Play Store or the Apple Store, and you can find it because we are giving it away for free for anyone who wants to use it and look at it. Um, so the trial is a two-arm randomized trial compared to a text messaging program. And the idea is we have a two-way interactive way of interacting, that's QuitBot, versus a one-way rule-based system that is a text-based program. So that's the concept. We have 1,647 participants in that trial. Our main outcome is 12 months post-randomization, 30-day point prevalence, abstinence. You can look at the trial protocol that is cited here at the bottom in Contemporary Clinical Trials. This is the consort diagram. We're following participants at 3, 6, and 12 months. This is where we've been recruiting our participants. We've completed recruitment, and you'll see they're coming from all 50 states of the United States. Here are our baseline characteristics, just briefly. Mean age 42, 60% female. We were able to include some transgender female and male and non-binary in our study. And then you'll see we had about 23% racial ethnic minority, about 8% of Hispanic ethnicity. Okay, this is not. Okay. Here are the retention rates we're seeing at 3, 6, and 12 months. So close to 90% in the trial. So very, very pleased by that. Here's our utilization data. We see that 97% of participants have used the app at least once, an average number of 38 session uses, and about 96 days of use. And we see that each of those utilization metrics is predictive of a smoking cessation. So that's very encouraging, and it shows that engagement does predict cessation in this type of intervention. Uh, Here are the top smoking-related queries from QuitBot that we coded. I give you an example. 22% of people asked about cravings, 15% asked about emotions, and then you can see the other types of queries that people made of the QuitBot of their own. So I mentioned dissemination was an important goal of our of our lab, we're very fortunate that Trevor Noah interviewed me about the QuitBot for one of his podcasts, and you can find that online. We also launched a website, quitbot.net, to disseminate this. So the Trevor Noah interview and the website have been very helpful to us in being able to have a platform to give away QuitBot to people who want to quit smoking. It will be free and always so. We're downloading at the rate of about 42,000 downloads per year, about 3,500 per month. In conclusion, I want to say that creating the QuitBot's ability for people to ask questions does require multiple iterations and verbal inputs. And so I can talk about how, if you're curious, you'd like to reach out to me about that process, I can talk to you about that because that's a really important part because people want to ask their own questions aside from having the rule-based system where you program hard what content you want to push out to participants. We're seeing that QuitBot has high engagement in a rigorous randomized trial with high retention, and soon we will have the outcomes of that study. The, uh, the dissemination impact is emerging, and we're already on to building the next version of QuitBot because these large language models are really improving at an exponential rate. So we're already building up the new architecture, and we're really excited about that. Thank you so much for your attention, and I'm happy to take questions.
Great, thank you. Yeah, great to see a full-scale trial on this. So, a question in the chat. So why do you think that GPT 3.5 did better than 4? Did you also try 4 at the time, or it was 3.5 that had come out when you were
4 had
developing?
not come out yet.
4 had
Yeah.
not come out yet.
Yeah,
Okay.
so each version works on more and more knowledge parameters, and each version is building in a better ability to prevent hallucination, which is the tendency to just make up responses,
Yeah.
and has better quality knowledge bases. So that's what we can count on seeing generally the case. You should still test and see if it is so for your particular domain and needs, because you can make a chatbot for a smoking cessation 100 different ways, depending on your treatment modality, your population, whatever is your focus. So that's really important that you do that work.
Yeah. So seems like you said 9 to 6 days of use, but seemed like it was under 30 days of support program. So the question is, I'm not sure I understand that right, or can you clarify this, how the bot relates users' ongoing journey? So was it an ongoing journey use beyond the support program?
It was both. Sometimes people could have the conversation last a couple of days. So there's a day's conversation that someone may come back to a day or two later. That's one path. Another path is someone's completed their program. They still want to come back to the bot because they have questions. They want to check in. They've developed a relationship, a connection to the bot, so they're coming back. So there's a lot of different paths that people take in using a bot, much like they would as if they had access to a coach to help them quit smoking.
Okay. And is it available in other languages? That was a question for before as well. So is it easy to just translate into other languages? Do you know?
It's not easy to translate into another language. It's not as
Mm,
simple as just doing a literal translation. Um, you could lose a lot in that translation. If someone's interested in that, we can certainly discuss it. We are making plans to translate it into Spanish. That's our most immediate plan. But certainly to do that, that requires not just language, but making it culturally appropriate.
yeah. Okay. Brilliant. Great. Thank you so much, Jonathan.